Hello, I'm Ilya Artemenko, a physical therapist at Dynamika Clinic. And today we will discuss a very interesting topic, namely one very interesting exercise that helps with absolutely different problems. And each of you can check right now how effective this exercise is. And let's talk about what problems it can help with. So if you have pain in both knees, or if you have some kind of irregular but absolutely unclear pain in one knee, there is no clear localization, but most often it occurs somewhere in the front part of the knee. Or maybe you have pain in both hip joints or in one, and it also occurs irregularly. Or maybe this pain occurs when you, for example, are working out and squatting, and most often it can appear at the very end of the squat's range of motion, somewhere right here. Or maybe when you walk for a long time or stand for a long time, your lower back starts to feel stiff. And you can't do anything about it? If you recognize yourself in any of these symptoms, then let's do this exercise. You will need to lie on your stomach and completely relax. Point your heels slightly outward. If your feet start to cramp in this position, you can put something under your legs. That's allowed. Place your hands as if you are about to do a push-up and you need to completely relax. The hardest part of this exercise is to be fully relaxed. As soon as you relax, start slowly pushing the floor away from you, arching your lower back. If, when you lift up, your pelvis comes off the floor, you can move your hands slightly forward. If during the movement you feel pain or are afraid to go further, then don't continue. You should touch the pain a little and lower yourself. Touch the pain a little, lower yourself, and with each repetition, try to bend further and further. So let's do it 10 times. One, two, three, 4, 5, 6, 7, 8, 9. Ten. Good job. Let's take a short break now and then do the second set. If you did everything correctly, then by the end of the first set, the range of motion in your lower back will increase and the discomfort will start to decrease. In this exercise, it's absolutely normal to feel discomfort at the very end of the range of motion, so don't worry about it. And let's do the second set. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Super. And now you can stand up and check your symptom again. If you had pain in both knees, or if you had some feeling of instability in your leg, like your leg was not obedient, then most likely these sensations will become much lighter. Most likely the pain in your knees, hip, or lower back will almost completely go away. You will feel as if your legs have become lighter and the discomfort has become much less. However, sometimes this exercise can make things a little worse, or nothing may change at all. So if you started to feel a little worse, don't be afraid, because now I will show you an exercise that will bring back and stabilize your condition. To do the opposite, lie on your back. Pull your legs toward yourself, grab your knees with your hands and absolutely relaxed. Gently pull your legs to your chest. The same thing works, only your hands are doing the work and you are completely relaxed. Do 10 to 15 of these repetitions and check again. Most likely you will feel much better. If you feel better after doing this exercise, you need to do it at least 3 times a day. As you may have noticed, it didn't take me much time to do this exercise. It won't take you long either. Please dedicate 1.5 to 2 minutes of your time to this exercise 3 times a day, and also do it after long periods of sitting or after a long drive. So, why does this exercise work in everyday life? We are very often in a bent position in everyday life. When we sit, our lower back is flexed. When we drive a car, our lower back is flexed. When we sit at the computer or watch television, our lower back is also often in a bent position. But the lower back can not only bend, it can also extend. But we often don't reach this range of motion, and that's why we start to experience some unpleasant sensations, which are directly related to the imbalance between these two directions. So, if this exercise helped you, feel free to use it for your health. If after doing this exercise nothing has changed, your knees still hurt or haven't gotten any better, the hip pain remains, and so on, then most likely the lumbar component is either not present in your problem or it's minimal. For that, consult a specialist who will assess and help you with your joints. But if this exercise helped you, keep doing it and stay healthy. All the best to everyone.